Our next topic is stridor. Noisy, harsh, difficult breathing. Why is it happening? Due to obstruction of the airway. Now it is classified as inspiratory, expiratory, and biphasic. So what is inspiratory? Okay, inspiratory occurs due to an obstruction at the level of vocal cords or above the vocal cords. Second type is expiratory. Expiratory is due to the obstruction at bronchial level, such as bronchial asthma. Third type is biphasic. Biphasic stridor occurs in tracheal and subglottic stenosis. In children, it is of crowing quality and it is called as crow. Salient features of stridor will be restlessness, okay, anxiety, distress, labored or noisy breathing, especially on inspiration. Okay, there is also difficulty swallowing, speaking. In children, you can also notice cyanosis, chest retraction, tachypnea, altered level of consciousness, and feeding difficulties. Okay. Now, what is the treatment for this? Treatment will be humidified oxygen. Okay. 2 is injection hydrocortisone. How much? 100 mg. IV route stat. It can be repeated as and when required. Injection ampicillin 500 mg QID route IV for 5 to 7 days. Okay, and that was 3. Injection adrenaline 0.2 to 0.5 mg subcutaneously if necessary. That's it. Thank you.